I don't know if you guys had any of that pie already, but that is some tasty stuff. That's from the bake sale that Lois was...
Oh, one down. I know somebody who won't be having any...
I'm starting to feel funny.
Well, I feel fine. I guess I'm gonna...
Oh, boy! That means I win! I get to eat...
Oh, God! Why didn't anybody tell me?
Gastroenteritis is one of the most common things that people present with when they go to outpatient clinics or emergency departments. In fact, the definition of the name, gastroenteritis, is broken down into inflammation of the stomach and intestines, i.e. the gastrointestinal tract, caused by something. Generally, it's caused by viruses, but it can also be caused by bacteria, toxins from either of these, or even other things such as parasites. Acute gastro is usually defined as diarrhea more than 3 times per day, which is usually accompanied by other things such as vomiting, fever, nauseousness, abdominal cramping. Secondary to this, some people may also get other symptoms such as a sore throat or a cough, but a lot of the time this can be related to excessive vomiting and the acid damaging the lining. The most common culprits of viral gastro are known as norovirus and rotavirus. You may have heard of breakouts of these on cruise ships where all of a sudden everyone comes down with the same symptoms and the same conditions very quickly. Yeah, that's norovirus. Other causes can be bacteria, as I mentioned, such as salmonella, or things such as staphylococcus and the toxins it produces, or from parasitic infections such as giardia, lamblia, or cryptosporidium. In terms of gastro being caused by toxins or viruses, usually they'll manifest themselves very quickly, 2 to 12 hours after ingestion or contact. And usually these symptoms will last for a few days and then they'll resolve by themselves, although it may take some time before your diet and stools truly get back to normal. Certain organisms can cause the gastro symptoms to last even longer, sometimes up to a few weeks at a time, and they can also cause more severe symptoms, some of which may require hospitalization and medical attention as well. And these will include things such as bloody diarrhea, severe dehydration, excessive and rapid weight loss, and severe abdominal cramping. A lot of these symptoms may indicate that it's a less common species causing these symptoms, something such as Clostridium difficile or certain species of E. coli. Oh, and those parasites I mentioned before. Yeah, they're nasty too. But for most of us, it's either a virus or a toxin that'll clear in a few days and we don't need any sort of treatment.
But how? My ass is like a hose and I spew so much I sound like Batman.
Well, first of all, we need to understand that the symptoms your body is experiencing is your body's actual response to fighting off an invasion. In essence, your body will switch off your gut, which is why people start feeling unwell before they throw everything back up, which is your body's way of just trying to clear out that body system, but also trying to clear out whatever the heck is causing the problem in the first place. It'll also crank up your body temperature and cause a fever, because that's part of your immune activation to go and fight off an invasion. As a result, you can't keep water down when you ingest it, you're losing it through your stools and through your vomiting, depending on if you have a fever through your sweat as well, so then you get dehydrated. And this contributes to feeling weak and awful and malaise and all of that. Now, if we were to add a medication to stop the diarrhea, or at least reduce the diarrhea somewhat, that also stops your body from getting rid of whatever microbe or toxin is causing this reaction in the first place. Therefore meaning it'll take you longer to get better. So we usually recommend avoiding these unless it's absolutely necessary, such as catching a plane home from another country. If someone is very nauseous and vomiting non-stop, antiemetic medication to help reduce those symptoms definitely could be indicated, but unless your doctor or medical professional is prescribing something that's what we call sublingual and can be dissolved under the tongue, it's unlikely that if you swallow a pill, it's going to be in the stomach long enough to be absorbed before you puke it back up. Realistically, the mainstay of any sort of treatment of gastro will be to manage the dehydration that you're going to suffer. And this will be through the use of oral rehydration salts and water. Oral rehydration salts are pretty much just solutions of salty water that contain all of the basic electrolytes that we need that are lost as a result of water excretion. So this will include things such as sodium and potassium and chloride. They also contain a little bit of glucose as well as a sugar. I would, however, avoid reaching for any sort of sports drinks. As much as these say they contain electrolytes, usually they have different ratios which have really high levels of sodium in them and less of the other electrolytes, as well as a lot of sugar, and this can also upset the balance in the body, and due to the amount of sodium, it can actually increase the level of dehydration you're suffering from. And of course, patients who get severely dehydrated or are at a higher risk of getting dehydrated, such as young children, they may require hospitalization and intravenous fluids. It's always important to check with your medical professional if you feel really unwell. Antibiotics, for the most part, aren't really indicated for gastro for the reasons I've outlined above. Usually it's caused by a virus or a toxin, and for the most part it's very tricky to actually isolate and test in pathology for what species might be causing the gastro. For example, there's so many different species of E. coli, it's very hard to isolate those with routine tests. So a lot of the time, if you do require antibiotics, it's because of the information you've provided to your doctor about things such as your travelling habits, what you've eaten, and if you have any of those severe symptoms I've mentioned above. Right. Now, in terms of what you should be eating as you're a popped balloon leaking all over the place, probably not going to be eating much in the first couple of days, period. When you are able to introduce foods, any sort of simple, bland, starchy food is usually best because it's easy to digest, there won't be anything in it such as spices and herbs that can act as gut irritants, and it pretty much just has a little bit of carbohydrates, proteins, and some fats that your body will need after losing so much of its fluid and mass. And this list would include things such as a plain bit of bread or toast, a boiled potato, a small cup of rice. Over time, your appetite will go back to normal and you can continue eating whatever you were eating before you got sick. If you had a severe infection because of certain bacterial species or those parasites I've mentioned, it can definitely take a while longer before your gastrointestinal tract will go back to normal, so you'll have to be very cautious with what foods you introduce and gauge what your body's response to that is. That's all for this video. In the next couple of weeks I plan on covering topics such as probiotics and would they have any indication in something such as gastro, or do they actually work, as well as how to properly use those oral rehydration salts. In the meantime, enjoy your week and I'll see you in the next one.